Can you believe pumpkin seeds could turn into a real problem for certain people? It might sound surprising, especially when pumpkin seeds are widely celebrated for their high nutrient content, plant-based proteins, and overall health benefits. Many individuals toss them into salads, blend them into smoothies, or munch on them as a quick snack, believing they're making a choice that supports better heart health, enhanced digestion, and balanced nutrition. Yet, as harmless as these little seeds seem, they can pose genuine risks if you happen to fall into certain health categories. No one likes to wake up with unexpected symptoms after a simple snack, and it's even more frustrating when the culprit is something you've always considered healthy. The truth is that bodies vary significantly, and what works wonders for one person can silently worsen health issues for another. The question is, could that be you or someone close to you? Pumpkin seeds, also referred to as pepitas, are prized for their pleasant, nutty flavor and robust nutritional profile. They're a good source of magnesium, zinc, healthy fats, and even antioxidants that help combat oxidative stress. Many dietitians encourage moderate consumption to support heart function, bone health, and even immunity. At the same time, these same seeds carry enough potency to irritate or exacerbate certain health conditions, a reality that often goes unmentioned amid the enthusiastic praise. Once you learn about the hidden pitfalls, you'll be better equipped to decide whether pumpkin seeds are a friend or foe to your wellness goals. It's not about demonizing a beneficial food. It's about recognizing that a great food can still be wrong for specific people. If you're used to throwing pumpkin seeds on your meals without a second thought, it might be time to take a closer look at how your body responds afterward. Red flags can appear in different ways, some subtle, some obvious, and staying informed is essential to safeguarding one's well-being. One of the first problems arises for individuals with an already sensitive digestive system. While pumpkin seeds are known for their fiber content, and for most people, this helps promote regular bowel movements and healthier gut bacteria. Those with conditions like IBS, Crohn's disease, or other inflammatory bowel concerns may find that this high-fiber snack leads to bloating, cramping, or uncomfortably frequent trips to the bathroom. The tough outer shells can be a challenge to break down, and even shelled pumpkin seeds still have enough fiber and natural compounds to irritate an inflamed gut lining. If you've ever experienced that unsettling feeling of fullness or sharp abdominal pains after eating seeds, there's a chance your digestive tract is protesting. Some people assume it's a random stomach bug or something else they ate, but repeated incidents after eating pumpkin seeds might be worth tracking. An elimination approach, where you remove them from your diet for a week or two, can confirm whether they're behind your symptoms. It's important not to ignore these signs because chronic irritation in the gut can lower your quality of life and trigger flare-ups in serious gastrointestinal conditions. People dealing with kidney problems should likewise think twice about pumpkin seeds. Many seeds, especially ones rich in minerals, can pose challenges if your kidneys are already compromised. Pumpkin seeds contain phosphorus, potassium, and magnesium, which are good for most healthy individuals. However, in someone with advanced kidney disease or reduced kidney function, the body isn't always able to filter out excess minerals effectively. The result could be an undesirable buildup of certain nutrients in the bloodstream. High potassium levels, for instance, can become dangerous if your kidneys don't do their job properly, leading to potential heart rhythm problems. Similarly, excessive phosphorus can contribute to bone issues in the long run because imbalances cause the body to draw calcium from bones to compensate. Doctors usually discuss restricting or moderating high phosphorus foods with their patients who have compromised kidneys, and those colorful charts might include seeds, nuts, and legumes. Pumpkin seeds might sound innocent, but the concentration of minerals can become a hidden hazard if the filtration system in your body is already strained. It's often recommended to consult with a renal nutritionist or your healthcare provider about how much phosphorus and potassium is safe for you. A fourth area of concern, and one that often catches people off guard, is allergies. Food sensitivities and allergies are not limited to peanuts or tree nuts. Seeds can trigger reactions too. If you're already aware of having issues with sesame seeds or sunflower seeds, your immune system might interpret pumpkin seeds as a similar threat. Allergic reactions to pumpkin seeds can manifest in various ways, from mild itching, rashes, and a scratchy throat, to more serious complications like swelling, wheezing, or difficulty breathing. The timing can be immediate, which makes it easier to pinpoint the cause, or it can be delayed, leaving you puzzled about what went wrong. Medical professionals sometimes advise those with known seed allergies to undergo testing for related seeds, just to make sure they aren't at risk. It's not uncommon for people to assume that because pumpkin seeds are less commonly flagged than, say, peanuts, they're automatically safe. This assumption can be hazardous. The key is to observe how your body reacts. If you notice itching in your mouth after eating seeds or an unusual tingling in your throat that you've never felt before, you may want to consider an allergy test. Individuals concerned about blood clotting should also be aware of potential interactions. While pumpkin seeds are not as famously associated with anticoagulant effects as some herbs or other seeds, certain components in them, like vitamin E and omega-3 fatty acids, may have subtle impacts on platelet function and blood viscosity. If you're on medication to reduce clotting risk, drugs such as warfarin, heparin, or newer anticoagulants, any additional influence on your blood's ability to clot can compound the effects of your medication. That could mean an increased tendency to bruise, or even dangerous internal bleeding in extreme cases. This doesn't apply to everyone, and the effect of pumpkin seeds alone is often small. However, for someone already on a finely calibrated medication regimen, even minor dietary influences can create unexpected shifts. Medical professionals typically ask patients about their consumption of vitamin K, fish oil, or supplements that might affect coagulation, but seeds often get overlooked in these conversations. If you're in doubt, it's best to bring it up with your doctor or pharmacist. A quick check-in can save you from complications that might arise from a potent combination of diet and medication. All these caveats might paint pumpkin seeds in a rather negative light, but that's not the intention. The aim is to provide clarity so you can make informed choices. Pumpkin seeds indeed boast a wealth of nutrients. They're known to contain beneficial antioxidants that protect cells from harmful free radicals. They can also supply protein that's valuable for muscle maintenance and overall energy. Dietitians often mention pumpkin seeds as a source of healthy fats, specifically unsaturated fats that support heart health when consumed in moderation. These fats contribute to stable cholesterol levels, which in turn help reduce plaque buildup in arteries. You'll also find that many people embrace pumpkin seeds for their high zinc content, essential for immune function and wound healing. The seeds may even offer some tryptophan, an amino acid that plays a role in promoting better sleep. Given these advantages, it's easy to see why pumpkin seeds occupy space in so many best healthy snack lists. The problem emerges only for those who fall into the health categories mentioned earlier, or for those who might be layering the seeds on top of an unbalanced diet and medications that amplify their effects. Plenty of us have turned to pumpkin seeds in pursuit of a more wholesome way to handle everyday cravings. Roasted pumpkin seeds can be surprisingly tasty, and they often replace chips or crackers for a snack that's lower in refined carbohydrates. If you're simply someone without any pre-existing conditions, you could be reaping all the positive attributes these seeds have to offer. Yet, for those who suspect that seeds might be contributing to gut troubles, episodes of dizziness, or lab results that show off-balance minerals, a little investigation goes a long way. For instance, you might keep a food journal, noting whenever you eat pumpkin seeds and tracking how you feel afterward. Sometimes it requires removing them from your meals for a week to see if symptoms improve. This doesn't have to be permanent if your body can tolerate smaller quantities, or if you find a better way to prepare them, such as soaking or roasting methods that can reduce certain compounds. The point is to ensure that your path to healthy eating is genuinely benefiting you, not adding hidden complications. All this talk might prompt you to wonder if the benefits outweigh the risks for the average person. In many cases, the answer is yes. The majority of healthy adults who are free from significant kidney issues, allergies, or extreme blood pressure concerns can enjoy pumpkin seeds as part of a balanced diet. One of the nicest things about them is their versatility. You can sprinkle them on salads, add them to oatmeal, or roast them with a pinch of sea salt for a simple snack. Their shelf life is generally good, and they're accessible in many grocery stores, making them a practical choice. Studies even point to pumpkin seeds supporting prostate health in men and alleviating certain menopausal symptoms in women, courtesy of their phytoestrogens and other plant compounds. The key is that dreaded word moderation, which pops up in almost every discussion about nutrition. Overdoing a so-called superfood can swiftly morph from beneficial to harmful if it overwhelms your body's specific needs or aggravates an existing condition. If you've been nodding along thinking, so maybe I do need to watch out for these seeds, there's no reason to panic. Often, a few easy modifications in how and when you eat them is all it takes. Soaking them can help reduce some of the phytic acids that bind to minerals, and portion control can help you avoid excessive amounts of magnesium or other elements. Pay attention to how you feel in the hours that follow snacking on them. And if you're on special medication or dealing with a diagnosed health issue, let your medical team know about your dietary habits. Pumpkin seeds may not be the first food that comes to mind in these discussions, but they're relevant enough to mention if you want the most accurate guidance possible. Your personal health story is shaped by many factors, including genetics, medications, lifestyle, and, yes, even small things like seeds. When you think about it, we place a lot of trust in the healthy label. Foods like pumpkin seeds, kale, or garlic get elevated to superfoods in the public imagination. That's fine and often well-deserved, but it can overshadow the fact that each food has potential downsides for particular individuals. There's no single ingredient that's 100% good or 100% bad for everyone. If you suspect pumpkin seeds might be tripping you up, there's value in exploring that hunch. Conversely, if you're free of the concerns mentioned here and find that pumpkin seeds give you more energy, keep you feeling satisfied between meals, and improve your sense of well-being, then there's no need to change what's working. The most important aspect is understanding how your body responds, rather than blindly following general advice. You now have the information you need to make smarter decisions about pumpkin seeds. The next step is up to you. Maybe that means continuing to snack on them, but making sure you aren't overindulging. Maybe it means cutting them out for a while or talking to your doctor about whether they're safe with your current medications. It might even mean you stumble upon a solution like roasting or soaking them in a particular way that makes them more digestible and less likely to trigger problems. Whatever you choose, you're taking control of your health by digging beneath surface-level claims and figuring out what really serves your body best. Don't forget that a small tweak in your routine can lead to major improvements over time if it helps you avoid complications. You deserve to feel confident about what you're putting into your body and certain that you're not setting yourself up for hidden risks.